But this is sort of a perfect time to introduce Kim Fernandez. As I said, Kim is the Executive Director of Federal Hill House. Federal Hill House is a member agency of the Food Bank, and they have 2 food pantries, one in Olneyville, one in Federal Hill. And Kim, I should also mention, on the board of directors of the Food Bank. Kim, thanks for joining us.
Thank you. Andrew, it's really great to be part of this and see all the names on there. I do have to do a shout out to my mom, who I see signed on, that I think one of my church friends probably told her about this. I saw her already signed up. So also proud supporters of the Food Bank. My parents are. And as Andrew said, I'm the Executive Director of Federal Hill House, and we operate 2 food pantries. I will note that both are in 02909, which is actually the zip code with the highest number of COVID-19 cases in the state of Rhode Island. And Federal Hills Food Pantry is right at the top of Atwells Avenue in the former Holy Ghost Church, which is now, the former Holy Ghost School next to the church. And the second one is in Olneyville, right on Manton Avenue, right in the middle of a huge number of various housing complexes and low-income housing. So we have a lot of folks that, really just walk right up to that pantry. And the pantries are both part of our larger group of programs and services. So in addition to our clients, we also do evidence-based home visiting. We have a childcare that's now temporarily closed, summer camps, a whole bunch of senior programs. And we've really been working with the food bank to convert the way we operate the food pantries to accommodate this crisis. We didn't miss any days. We kind of transitioned straight away to grab and go bags. The food bank was able to convert to increased deliveries, which was wonderful. So for example, the last week of February, we saw just over 600 clients that week in both of our pantries. And last week we saw almost 900 across the two sites. And that's just the guest. So each guest, I think we usually calculate, when we do collect the data, it was usually about 2.5 is the average people per household. So if you do that math, it's a huge increase. And a lot of new clients, a lot of new guests are coming in, people who've heard through word of mouth, people who have called 211 or called the food bank for a referral. And so we anticipate a lot of those people will continue. We think this is going to be a long-term need. Even as the economy opens up, many of our guests are lower income, particularly, we have a segment of undocumented folks who probably won't be able to rejoin the economy as quickly as everybody else. And we also have a really high senior population. So across both of the pantries, we serve about 250 of the commodity boxes that come from the food bank, in addition to the regular food that folks can get. And we've been actually working on doing a bunch of deliveries of those boxes. A lot of seniors are afraid to come out, or they can't, they don't have the ride that they used to ride, or they don't want to get on the bus the same way that they used to. So we've been delivering more of those, and also delivering regular groceries from the food pantry to our folks. But it's been amazing to have the food bank be able to accommodate the increased need and just work really in partnership with us very quickly.
Well, thank you for everything that you're doing. It's incredible. Talk a little bit about, do you see this need growing over the next little while, the next few months?
I do, because I think people are afraid to come out right now. I think that as it opens up just a little bit more, folks who really probably need the food now but are really struggling will feel a little bit more comfortable going out. And when we show the pictures, I'll show some of the social distancing practices that we're doing to keep people safe. But unemployment's extended, right? But the bonus only lasts through July. So I think that there's some food assistance, some cash assistance that's helping people, but it's not going to last forever. And I
Yeah,
think the word of mouth, I think people come and they have a good experience. It's just like anything. I mean, budgets are always tight. So if they come, they have a good experience, they like the food they're getting, they like the customer service, they're going to continue.
absolutely. And, you know, I think that that's a really important point about the federal help that people are getting. There's also been extra help for families through SNAP. There was this pandemic EBT program that's going on now that's giving families with school-age children an EBT card with $100, $200 worth of benefits on it to be able to buy groceries. Oh, that's terrific. I mean, thanks goodness for those programs, but they all will disappear in the next few months. And
Mhm.
things, when that help goes away, I think that's another reason that we're going to see the need grow.
I agree. I agree. And I think that some people, um, I'm curious about people who maybe aren't eligible for SNAP, but then they get these particular benefits. Will they actually use them? They might feel like that's going to put them in some sort of jeopardy with their immigration or something like that. I feel like we're trying to get the word out that they're two completely separate arenas. But I worry that some folks won't use it out of fear. And a lot of those you can't get those SNAP benefits don't work for delivery or anything like that. So depending on your mobility and your safety,